Hair transplant. For many people, this word automatically means one city, Istanbul. But has anyone ever wondered why it is so cheap there? Because the answer to this question should interest you before you book your ticket. Turkey has been building medical tourism for years. Prices are lower than in Western Europe, the United States, or Australia. And this attracts patients from all over the world. But where does this difference come from? First of all, the Turkish government subsidizes medical facilities involved in medical tourism. In the European Union, there are no subsidies for plastic surgery. Secondly, and this is crucial, employee costs. In many Turkish clinics, procedures are performed by so-called technicians, individuals trained for one task but without medical education. One doctor supervises several teams at the same time. A cheaper employee means a lower cost of the procedure. Simple. In the European Union, such practices are illegal. Medical procedures can only be performed by doctors in person, not remotely, not from another room, not via camera. You will also find information on the internet that Turkish clinics have technology that is not available in Poland. Micro FUE, extra FUE, Turkish FUE. Sounds impressive, but do you know what it all is? Just regular FUE. The same method, just incise the epidermis around the hair follicle and pull it out. The name on the packaging is changing, but the content is the same. There are two methods of hair transplantation worldwide: follicular unit transplantation and follicular unit extraction. There is no third option. There is no secret Turkish technology. There is marketing that invents new names for the same procedure. And I will say something important, so as not to be unfair. In Turkey, there are outstanding specialists, doctors who perform procedures personally at the highest level in accordance with the art of medicine, just like in every country in the world. The problem does not concern Turkey as a country. The problem concerns dishonest institutions focused solely on profit, where you are a customer, not a patient. And such facilities exist everywhere. But there, where legal regulations are looser, there are simply more of them. If you are still considering a trip, ask yourself a few questions before you board the plane. Who exactly will be performing the procedure? Not who supervises, but who is holding the instrument in their hand. What qualifications does he or she have? Is he or she a doctor? Ask for documentation. You have every right to do so. And one more thing, what will you do if complications arise when you return home? Who will examine you? Who will implement the treatment? Because the doctor in Istanbul won't see you for a follow-up appointment next week. A low price always has its source. Sometimes it is a government subsidy, sometimes it is cheaper staff without medical education. Your task is to find out which of these options lowered the price of your procedure. So the next time you see an advertisement online about the best specialists in Turkey, don't believe it. Say, I check. Ask for a diploma. Because in most cases, this specialist is someone without a medical education, trained for one task. Just because someone has performed even 1,000 procedures illegally does not make them a doctor. The cheapest transplant that needs to be corrected later may be the most expensive for you. Thank you for participating in today's lesson, and I invite you to the next micro lectures.